Hi, everyone. My name is Alex Lopez. I'm the Chief Commercial Officer for Ace Vision Group. Thanks to the organizers, Craig and Maureen, for the invitation. Super excited to be here. And I'll be speaking about presbyopia. I saw Praveen's slide earlier around the presbyopia market, and one of our objectives is to bring sexy back to ophthalmology and start the discussion again on presbyopia. It's a massive market, continues to be an untapped market, and we're very excited about our technology. Our CEO is Dr. Anne-Marie Hipsley. She's a PhD in biomechanics, and presbyopia is an aging problem, and it's a biomechanical problem, and I'll go into some of those details. Thank you to two doctors, Dr. Mitch Jackson and Dr. Bobby Yang, who did a lot of the work and continue to support our effort to bring this product into market. Our treatment is laser scleral microporation. We have proven that it's safe, effective, and repeatable, three key ingredients to making sure that we have a product that will be commercially viable in the near future. So what is the core problem? To truly understand it, we need to understand that the problem is ocular rigidity. It's aging stiffens the sclera, an internal lens inside the eye. It's more than just a lens problem, but we're finding is that there's also an increase in scleral rigidity. It increased biomechanical stiffness, which decreases dynamic range of focus, which is the patient's ability to accommodate. And we now know that it also disaccommodates. And the result is decreased ciliary muscle, and as the patient ages, they lose their ability to focus, especially at near vision. And to be clear, this is not a refractive problem, so we're not correcting the refractive error. So what is actually going on in the cornea? There's a scleral cross-linking. It's called advanced glycation end products that results in cross-linking of collagen microfibers. And you can see here that over time, it's increasing the density and the scleral rigidity, causing loss of visual acuity. Our solution is Visiolite ophthalmic laser, the treatment laser scleral microporation that reduces ocular rigidity that causes presbyopia. The treatment is minimally invasive, touchless to the patient. It's outside the visual axis, which makes it really safe, and it's an in-office procedure. You can see here, it's very simple. The patient looks at a fixated point. It's an Erbium YAG laser that gets applied to the sclera. It creates a quadrant of micropores. There's a total of 4 different quadrants. Each one takes about 8 seconds. This is pretty close to real time, and the result is the patients regain the vision that they lost when they were younger. So you would tell the patient, we're going to regain the vision that you had in your late 30s, early 40s, and they regain that near vision, intermediate, and for low hyperopes, they also regain their distance vision. So if we look at a little closer at what's actually going on, the Erbium YAG laser is applied to the sclera at 85% depth. The depth and location of the micropores does make an impact to the overall effectiveness. And what it's doing is uncross-linking those scleral fibers, loosening them up and making it more pliable, essentially decreasing the ciliary muscle force, and the result is that the patients regain the vision that they've lost. We do have excellent study. We just finished our 24-month data out of the Philippines with Dr. Bobby Yang. This is the same study protocol that we plan to move forward with through our regulatory and approvals mid-next year. Patients reported needing reading glasses after their treatment. These are a total of 50 patients, 100 eyes. Average age was 57 years old, plus or minus 4 years. We also looked at various points as well when we did the study, and we did a NAVQ rash score as well. So the results, patients reported needing reading glasses. That was part of the criteria going into the study, and all patients reported not needing reading glasses after the treatment as early as the same day as the treatment, all in post-op day 1, and that was sustained over a 24-month period. On the rash score, patients reported a reading difficulty of 63, and we saw a significant reduction in reading difficulty immediately after the procedure and sustained over a 24-month period. So we also checked distance-corrected visual acuities, and you can see there's an improvement there as well, and that was also sustained over 24 months. Essentially, it allows the eye to just restore its natural function as what it did before. If a patient does have a refractive error, that'll have to be addressed with other mediums like LASIK. So we know it's dosable, which we've had in a few of our patients. So patients here, you can see there's a micropore. The younger the patient, the less dose that we need to apply to that patient. On average, we expect that the patient will come back about every 3 years to get another dose. Why is this important? because presbyopia is an aging problem. So as the patient progresses, we're going to have to retreat that patient over time, making sure they stay out of glasses, keeping them below 1.5 diopters so they can read. We know that that's the threshold for reading. We can do the treatment up to 7 or 8 times, and we go back and fill in the diamond shape that you see up there over time. So we start at 16 micropores, and we can increase it all the way up to 64 micropores in that same region. So the patients have an excellent experience from that perspective as well. Patients can come in, they have their treatment, they see immediately post-op day 1, 20/40 or better. That's what it looks like under a microscope, the micropores on the sclera. They can read, they can swim, they can go back to their daily activities the same day, and it's not visible under the naked eye. So in summary, LSM is safe, effective, and repeatable. We're excited that we're starting a regulatory path next year to have some pre-commercial sales in 2025 and a full commercial launch in 2026. And we are in our Series B2 round of funding. We're raising $16 million. We're almost 2/3 of the way there, and that'll fund us through the end of next year. Then we'll enter our Series C round of funding, and that'll fund us through our commercialization and our commercial launch, expected to be in 2026. Great. Thank you. I'll be in the back if anybody has any questions. Thank you for your time.